Test is because, remember this morning we talked about how in order to have full abduction of the shoulder, you need the glenohumeral joint to move properly, and then also we need the scapula to rotate in order to move properly. So in somebody like Jennifer, after we did the first test and determined that she has an issue there, then we would do the second test for sure with her because she had pain to see if the shoulder pain and decreased range of motion is coming more from the GH joint or possibly more from the scapula is not moving properly. Okay, so the first test that we did just is totally passive to the end range of motion. This is what a more normal range of motion is going to look like. And if it's normal, once we get to the end, we can do just a little bit of overpressure to see if that elicits any kind of pain. Okay, so remember what we're looking for, as we talked about, is decreased range of motion or pain. So you need to communicate with the person. You need to tell them that you have to say stop or it's painful when it is. Okay? So then if that is painful, if we do have a restriction or pain, then we're going to monitor the shoulder blade. So we're going to monitor the inferior angle of the shoulder blade, just above the inferior angle of the shoulder blade. And we're going to do, again, passive abduction. And you guys can move. And we should be able to get to 80 to 90 degrees before the shoulder blade actually starts to move. So when you're palpating the inferior angle of the shoulder blade, you are going to feel all sorts of things moving. You're going to feel skin moving, you're going to feel fascia moving, you're going to feel muscle moving, everything that covers over top you're going to feel moving. What you need to be testing is actual movement of the scapula. So you're going to find the borders of the scapula, find the inferior angle, put your thumb along the lateral border of the scapula, and as you come into abduction, after you get to 80 to 90 degrees, then the scapula should start to move. What you're trying to determine is if the scapula is rotating after they get to about that 90 degrees or if it starts rotating sooner. Okay? So that's what you're monitoring, so that we can determine whether there's more of an issue in the glenohumeral joint or more of an issue because the scapula is not rotating. Okay? Questions about that? If there's a capsular pattern going on, maybe some arthritis, capsulitis, this range of motion is going to be the most limited. Okay? Plus, when we do passive lateral rotation, it also stretches the medial rotators. So she might get some pull or stretch feeling in the front. Okay? So again, you need to say stop or tell me when it's painful. Okay? And just try to totally be passive. There in this position, you want to keep the elbow by the side, because if we don't, we're going to get abduction, flexion, extension, a whole bunch of other things in there too. All we want is external rotation. So I have to monitor by keeping the elbow at the side. So I'm holding the joint stable, so all that I'm getting is rotation through the shoulder joint and not getting flexion, extension, AB or adduction. So the normal range of motion in this position should be about 80 degrees. So again, I'm coming to that pathological motion barrier where I feel, and she could probably feel, that I'm at the end of her comfortable range of motion. Okay? Once I get it to there, if there's no pain, I'm going to try to take it right to its anatomical range, because that's what I want to do for testing purposes. Okay? Normal range of motion should be 80 degrees, which she has plenty. She almost has 90. Okay? So if, first of all, we do that. If this is really restricted, then we probably don't do the next test, which is up here. Really good question. The only time you do overpressure is if there's no pain through the whole range of motion. So if we got her to the end of her range of motion with no pain, we can do a little bit of overpressure just to see if that elicits any kind of pain. And then if it does, we make a note in that, and then we'll figure out what that is. Okay? So if this is okay and not too bad, then we can bring her up to shoulder height and do the test here. Now here, the normal is 120 degrees. So this would be 90 degrees. 120 degrees is going to be back there somewhere. So again, we need to stabilize her joint in a passive position so that all we're doing is external rotation or lateral rotation. So you want to picture the joint right there. That's the rotation that we're trying to get. So we're stabilizing her in this position, and I'm going to bring her to her pathological range first, and it's usually tighter in this position, and this really tests the length of the anterior, or sorry, medial rotators, the subscap and the pecs, okay? So again, you say stop. Probably right about there. No pain, but I can feel that leathery end feel. Okay, so that's the pathological motion barrier. I'll go a little bit further, and she has more than enough range of motion. Okay, so what we're noting in our notes is if she has abnormal range or pain. If it's normal, then bonus. Okay, so you need to become familiar with what normal feels like and what it looks like to know what abnormal is. And that's what doing this is all about. Okay, so it's internal rotation that we're doing. So because we're doing internal rotation, it's going to stretch the external rotators. Okay, say that with me. We're testing passive internal rotation, which stretches the external rotators. Okay, so internal rotation, the first thing that we're going to get them to do is just put their hand on the back of their waist. And I can already tell, just by the way she's doing this, that she's really tight here, okay? So I bet you when she did that reach back test, she wasn't so good. So again, a lot of the information that we're going to get more specifically from these tests, we might have got from those first 3 tests this morning already, but this is a lot more specific, okay? So passive medial rotation, this one, it's really, you really have to make sure that you stabilize the scapula and the humerus before you try to go into more medial rotation, or you're going to get a false reading here. We want to get one motion only, okay? So, arm behind the back. We're going to put this arm across just underneath the scapula, and we're going to hold on to the humerus. From here, if she can get her arm on her waist, then we're going to just stand straight, stabilize yourself, put your feet apart just a bit. Okay, turn your abs on, be strong, okay? And then I'm just going to try to pull the arm off the back, okay? So what that's doing is putting it into full internal rotation, okay? Full internal rotation. If I don't stabilize everything here, I'm going to be getting extension and abduction and a whole bunch of other things all going on, okay? So, again, I want to hold on to the humerus, get her to bring her arm back, okay? Keep that stabilized there by pushing a little bit forward, and then try to pull her arm off her back, okay? So basically, if you can get the arm to come off the back 10 to 15 degrees, that's okay. I can tell she's just even having trouble getting it there. So I know her internal rotation is tight before we even do that. Let's try this arm. Okay, so from here, I'm going to come across this way now, okay? And I wouldn't stand like this, but I'm trying to get out of the way for you guys. And then just try to pull that arm off. And you can see that this shoulder has much better internal rotation. And again, we don't want to let this shoulder be drifting anywhere. We want to hold it there, okay? Good.
Horizontal abduction,
Okay.
AC joint test. Stand at the client's side, opposite the shoulder to be tested. Stabilize behind the scapula nearest to you.
Oh, okay, I got an extra in there. Okay, so this is a test for AC joint problems. So the passive abduction was testing the glenohumeral joint and the scapular motion. Now this test is going to test the AC joint, the acromioclavicular joint. So I'm going to stand on the opposite side of the body, and again, relax and give me your arm. You can actually even put your arm right there. Stand facing forward. I'm going to stabilize her here so that she doesn't do a bunch of that, okay? And I'm just going to bring her arm across the front of her body, okay? With guys with big pecs or women with big boobs, you might get a little bit in the way, so you might have to lift just a little bit. Then you might get that soft end feel that we talked about because of tissue approximation, and that's okay. But you're going to come across to that end, and if there's no pain, then you're going to do a little overpressure, okay? So you're just going to jerk like that and see if that elicits any pain. If it did, then that would indicate problems in her AC joint, okay? Let's do it on this funky shoulder. Okay, so again, stabilize here, keep her in a neutral position, and I can tell already that it really doesn't want to come there, and it's probably from all of this tightness that we already determined because her internal rotation is bad, okay? Any pain in the joint there?